France, 1916, a trench somewhere on the Western Front. The mud is 6 inches deep, and the smell is something no one who experienced it ever forgot. Rot, smoke, unwashed bodies, and underneath all of it, something organic and sweet that the soldiers couldn't name. A medic is moving through the trench on his hands and knees, reaching a man who has taken shrapnel to the upper thigh. The wound is not immediately fatal. The shrapnel missed the femoral artery. In a modern hospital, this man survives without question. In this trench, in 1916, the question is entirely open. The medic reaches into his kit. Not penicillin. Alexander Fleming won't make his observation for another 12 years. Not sulfa drugs. Those are 20 years away. He reaches for something his grandmother might have used, a bundle of dried leaves, feathery and pale green, with a faint, sharp smell somewhere between camphor and fresh grass. He packs the wound. He moves to the next man. 2,000 years before that trench on a plain outside Troy, a warrior named Achilles knelt beside a fallen comrade and did the same thing. The plant has the same name in both places. In Greek, it carries his name directly, Achillea. In English, we call it yarrow. In the Ottoman pharmacopoeia, it was Binbu de Otu, the 1,000-grain herb. The Cherokee called it by their own name. The Vikings called it by theirs. Every culture that ever went to war, on every continent where it grows, independently reached the same conclusion about the same plant. And now, 3,000 years after the first recorded use, we know exactly why it worked. This is the story of Achillea millefolium, the plant that followed humanity into every war for 3 millennia, and the chemistry that explains why soldiers who had never read a book were right about it all along. Before we go further, we need to understand the world in which yarrow mattered most. Because the thing that made this plant extraordinary was not its rarity or its mystique. It was the problem it was solving. And that problem was so universal, so consistently deadly across so many centuries of human history, that it reshaped the outcome of wars, the survival rates of armies, and the demographic trajectory of entire civilizations. The problem was infection, not the wound itself. The wound was often survivable. What killed soldiers, what killed the overwhelming majority of combat casualties across virtually the entire span of human military history until the 20th century, was what happened to the wound afterward. Yersinia pestis killed 50 million people in the 14th century. But across the same period, across every century from the Bronze Age to the First World War, the bacterium that killed more soldiers than any enemy army was Staphylococcus aureus, or Clostridium perfringens, the agent of gas gangrene, or Streptococcus pyogenes, the agent of erysipelas and septicemia. These were not exotic pathogens. They were everywhere. They were in the soil, in the air, on the skin of the soldiers themselves. A puncture wound, a shrapnel fragment, an arrow that passed through clothing. Any of these could introduce enough bacterial load to begin a cascade of infection that a pre-antibiotic body had limited tools to stop. Napoleon's surgeons understood this. In the Grande Armées campaigns of the early 19th century, the battlefield mortality rate from wounds was catastrophic, but the breakdown is telling. Roughly 20% of soldiers died from the initial wound. The remaining 80% of battlefield deaths came from infection in the days and weeks that followed. Gangrene, sepsis, wound fever. The enemy that Napoleon's medical corps faced was not Russian cavalry. It was the bacteria that entered every wound the moment it was made. This was the problem that yarrow was solving, not the wound. The aftermath of the wound. And it was solving it with a chemistry that nobody understood and nobody needed to understand. Because the result was visible, repeatable, and consistent enough that every culture that encountered it reached the same conclusion independently. That convergence is the most important thing about yarrow's history, Not that one civilization discovered it and passed the knowledge down, but that dozens of civilizations, separated by oceans and centuries, arrived at the same plant for the same purpose through their own observation. Independent discovery at that scale is not folklore. It is data. The name is the starting point, Achillea millefolium. The genus name, Achillea, derives directly from Achilles, the Greek hero of the Trojan War. This is not a modern botanical designation. The association between Achilles and this plant is ancient, consistent, and appears in multiple independent classical sources. The earliest and most famous source is Homer's Iliad, composed in the 8th century BC, but reflecting oral traditions considerably older. In the Iliad, Achilles is described as having been taught the medicinal properties of plants by the centaur Chiron, the same mythological figure credited with teaching medicine to the physician Asclepius. The specific association with wound treatment is reinforced in later classical texts. The 2nd century AD writer Pliny the Elder references the Achilles-Yarrow connection directly in his Natural History, as does the Roman physician and pharmacologist Dioscorides, who wrote the most comprehensive pharmacological text of the ancient world, De Materia Medica, in the 1st century AD. Dioscorides did not call the plant yarrow. He called it strategion, the general's plant, or more precisely, the military commander's plant. His entry is specific and practical. The plant, he wrote, stops the flow of blood from wounds, reduces inflammation, and may be applied fresh or dried to combat injuries. This is not mythology. This is a 1st century clinical description, the closest thing the ancient world had to a pharmacological monograph, describing exactly the application that soldiers across 3,000 years of warfare would independently confirm. The Romans took this seriously. The legions of the Roman army carried Achillea millefolium as a standard item in their field medical kits. The Roman name for it was Herba militaris, the soldier's herb. This designation appears in Roman medical texts and is consistent with the plant's documented use in legionary field medicine. To understand why the Romans would standardize a botanical inclusion in military medical supplies, you need to understand the scale and organization of Roman military medicine. The Roman army had the most sophisticated medical corps in the ancient world, dedicated physicians attached to each legion, field hospitals called valetudinaria established at permanent camps, and a systematic approach to wound treatment that was, by the standards of the time, extraordinarily organized. Roman military physicians understood, empirically, that wound management was the critical variable in battlefield survival. They did not know about bacteria, but they observed over generations of military campaigns that wounds treated with certain substances became infected less often than wounds left untreated or treated with other substances. Yarrow was one of those substances. The inclusion of Herba militaris in legionary medical kits was not superstition. It was the result of accumulated military medical observation over centuries of warfare. The Greek sources that preceded Roman standardization were themselves reflecting an even older oral tradition, one that the Iliad crystallized into mythology precisely because the plant's effectiveness was common enough knowledge to be associated with the greatest warrior of the age. Achilles was not described as using yarrow because the Greeks invented a magical property for it. He was described as using yarrow because the Greeks used yarrow, and a hero needed to do what warriors did. The mythology followed the practice, not the other way around. One more source deserves particular attention. The Byzantine physician Dioscorides of Anazarbus, not to be confused with the 1st century Dioscorides, though they share a name, who compiled later medical traditions that continued to reference Achillea millefolium in wound management contexts well into the medieval period. The thread from Homer's Troy to the medieval European battlefield runs unbroken. The plant changed names as it crossed cultures and centuries. The application never changed. The Roman Empire fell. The knowledge didn't. What happened to yarrow's medical use in the centuries between the fall of Rome and the emergence of early modern medicine is one of the most striking examples of parallel cultural transmission in botanical history. Because the knowledge didn't travel along a single route, it fragmented, dispersed, and re-emerged independently across multiple cultures that had no direct contact with one another. In Scandinavia, the Old Norse sagas reference a plant called gullet, golden herb, in wound management contexts consistent with yarrow. Viking warriors whose combat culture was intimately concerned with the practical management of battle injuries carried knowledge of wound herbs that appears in the Eddic literature and in later medieval Scandinavian herbals. The plant described matches Achillea millefolium in its appearance, habitat, and application. The Vikings were not reading Dioscorides. They were observing the same plant in the same landscape for the same purpose and arriving at the same conclusions. In medieval European monastic medicine, yarrow was a standard inclusion in the physic gardens that Benedictine and Cistercian monasteries maintained as part of their medical mission. The great medieval herbals, the Physica of Hildegard of Bingen, written in the 12th century, the Circa Instans of the Salernitan school, the later Gott der Gesundheit, all reference yarrow in wound treatment contexts. Hildegard of Bingen, whose botanical knowledge was remarkable by any standard, described the plant's properties in terms that a modern pharmacologist would find directionally accurate: its ability to close wounds and resist putrefaction. She did not know what putrefaction was at the microbial level. She had observed what prevented it. Across the Atlantic, and this is the detail that makes yarrow's story genuinely extraordinary, indigenous North American nations had arrived at identical conclusions entirely independently. The Cherokee used Achillea millefolium as a wound herb. So did the Ojibwe, the Navajo, the Zuni, the Menominee, and dozens of other nations across a geographic range from the eastern woodlands to the desert southwest. The applications recorded by ethnobotanists in the 19th and 20th centuries, staunching bleeding, preventing wound infection, reducing inflammation, match the Dioscorides description from the 1st century AD with a precision that cannot be explained by cultural diffusion. Yarrow grows across North America. Indigenous nations observed it, tested it empirically over generations, and reached the same conclusions as Greek, Roman, Viking, and medieval European practitioners. Because the plant's chemistry is the same on every continent where it grows, and that chemistry produces the same observable results regardless of who is doing the observing. This is the central argument of yarrow's history, and it is worth stating clearly. When completely isolated human cultures, separated by oceans, independently identify the same plant for the same medical application over a period of 3,000 years, that convergence is not coincidence. It is empirical data accumulated across the largest possible sample size, all of human experience. In the Ottoman Pharmacopoeia, Achillea millefolium appears as Binbude otu, the thousand-grain herb, a reference to the plant's finely divided leaves. Ottoman military medicine, which was sophisticated by the standards of its era, referenced the plant in wound management contexts, consistent with its use across other traditions. The Ottoman military campaigns of the 15th through 17th centuries, which covered an enormous geographic range from the Balkans to Persia to North Africa, would have brought military physicians into contact with local yarrow populations across this entire range, and the Ottoman medical tradition synthesized Greek, Arab, and Persian pharmaceutical knowledge in ways that preserved and extended the Dioscorides tradition. What is striking, looking at this geographic and chronological spread, is not the specific cultural details of each tradition's use, What is striking is the consistency of the core application. Across every culture, across every century, across every continent where the plant grows, and where humans have gone to war, stop the bleeding, prevent the infection, close the wound. The specific terminology changes, the underlying observation does not. By 1914, the world was on the edge of a medical revolution that it didn't yet know was coming. Alexander Fleming's observation of penicillin-producing mold would not occur until 1928. Sulfonamide antibiotics would not be clinically available until the mid-1930s. The soldiers who went into the trenches of the Western Front in August 1914 were, in terms of wound infection management, living in essentially the same pharmaceutical world as the soldiers of Napoleon's Grande Armée. The antiseptic revolution of Lister and Semmelweis had changed surgical practice significantly. Surgeons now understood the importance of cleanliness in preventing wound infection, even if the mechanism was not yet fully understood by all practitioners. But in the field, under fire, in a trench that was simultaneously a fighting position and a drainage ditch for the mud of Flanders, the gap between what surgical theory recommended and what was practically available was vast. The Western Front created wound infection conditions that were, in some respects, worse than anything previous European warfare had produced. The soil of Belgium and northern France had been under intensive agricultural cultivation for centuries. It was rich in the spores of Clostridium perfringens, the anaerobic bacterium responsible for gas gangrene. Shrapnel wounds, which were far more common than clean bullet wounds in this artillery-dominated war, drove soil, clothing fibers, and bacterial load deep into tissue. Gas gangrene, the infection of deep tissue by Clostridium perfringens, producing the characteristic tissue death and gas production that gave the condition its name, was epidemic in the early months of the war. By some estimates, between 10 and 15% of all serious wounds treated in the first year of the conflict developed gas gangrene. The mortality rate from gas gangrene, without the antibiotic treatment that didn't yet exist, was between 25 and 50%. In British and French field medical records from the early war period, there are scattered but consistent references to the use of yarrow, under its common English name, as milfoil in French sources, as Schafgarbe in German, by individual medical officers and soldiers who had learned of it through folk tradition. These are not institutional records. They are personal accounts, diary entries, unit medical logs. The institutional medical practice of all major armies in the First World War was based on antiseptic principles: carbolic acid, iodine, saline irrigation. Yarrow was not part of any military pharmacopoeia in 1914, but it was part of what soldiers and rural medical officers remembered from civilian life. The most significant document in this regard comes from the ethnobotanical record rather than the official military medical archive. Multiple independent accounts recorded in the interwar period by researchers collecting folk medical knowledge from surviving veterans describe the use of yarrow as a field dressing plant during the war, consistent with a living traditional knowledge that had never entirely been displaced by institutional medicine. This is the last chapter of yarrow's military history, not because the plant stopped being effective, but because what came after it made the question moot. Fleming's penicillin and the sulfonamides that preceded it in clinical use replaced the entire category of wound management that yarrow had occupied for 3 millennia. Not because yarrow was wrong, because something better arrived. Now, the chemistry. Because the history is remarkable. But the chemistry is what transforms the history from an interesting story into a documented scientific fact. Achillea millefolium contains a complex mixture of bioactive compounds that have been characterized in modern phytochemical research. The most important for wound management are four: achillin and achillikin, Sesquiterpene, lactones that contribute to the plant's anti-inflammatory activity. Azulene, a blue-colored compound produced when the plant's essential oil is steam distilled, derived from the precursor matricine, which has demonstrated anti-inflammatory and antimicrobial properties in modern research. Apigenin, a flavonoid with documented anti-inflammatory activity, and in laboratory studies demonstrated antimicrobial effects against both gram-positive and gram-negative bacteria, and most directly relevant to the plant's wound-staunching reputation, a group of compounds that influence platelet aggregation and coagulation cascade activity. Specifically, research has shown that yarrow extracts can accelerate clot formation in vitro, consistent with the ancient observation that the plant stops bleeding faster than an untreated wound. Taken together, these compounds explain every major traditional application of yarrow in wound management. The hemostatic effect, stopping bleeding, is explained by the coagulation-enhancing compounds. The prevention of wound infection is explained by the antimicrobial activity of azulene, apigenin, and the plant's volatile oils, which include camphor, borneol, and cineole, all compounds with documented antimicrobial properties. The reduction of inflammation is explained by the flavonoids and sesquiterpene lactones. The soldiers who packed yarrow into wounds in the trenches of the Somme, the warriors who carried it into battle at Troy, the Cherokee healers who applied it to hunting injuries in the forests of the eastern woodlands. None of them knew any of this. They knew what they had observed. And what they had observed across 3,000 years and every inhabited continent on Earth was correct. Before we close the caveats, because this story, like every story on this channel, requires intellectual honesty about what the evidence actually supports and where it stops. First, yarrow is not a treatment for serious wounds. The hemostatic and antimicrobial properties documented in modern research are real and well characterized. They explain why the plant performed better than nothing in pre-antibiotic wound management. They do not make yarrow equivalent to modern wound care. A serious wound today requires cleaning, closure, and in many cases antibiotic prophylaxis. If you are injured, you go to a doctor. The 3,000-year history of yarrow's military use is a testament to human empirical observation. It is not an argument for treating modern injuries with field-gathered plants. Second, yarrow contains compounds that are contraindicated in pregnancy. Specifically, the plant's volatile oils, including camphor and thujone, have documented uterotonic effects, meaning they can stimulate uterine contraction. The use of yarrow in any form during pregnancy is not recommended, and this is not a minor caveat. It is a direct contraindication supported by pharmacological evidence. If you are pregnant, do not use yarrow in medicinal quantities. Third, Achillea millefolium belongs to the Asteraceae family, the same plant family as ragweed and chamomile. Individuals with known allergies to plants in this family, particularly those with ragweed or chrysanthemum allergies, may experience allergic reactions to yarrow, including contact dermatitis from topical application and respiratory reactions from inhaled plant material. Fourth, the in vitro antimicrobial activity documented for yarrow's bioactive compounds does not translate directly to clinical efficacy. Laboratory conditions are controlled. A wound is not. The concentrations of active compounds achievable through topical application of crushed plant material to a wound are not the same as the concentrations used in laboratory assays. The empirical evidence from 3,000 years of use is historically compelling. The clinical trial evidence for yarrow as a wound treatment is limited by modern standards. These are different categories of evidence. Now, the outro. There is a field in Belgium where the grass grows thick and the soil is dark with centuries of cultivation. Under that soil, invisible, undetectable, are the spores of the same bacteria that killed soldiers in the trenches above it 100 years ago. And in the same field, growing from the same soil, is Achillea millefolium, white flowers, feathery leaves, a faint, sharp smell. It has been in that field, or fields like it, for as long as humans have been going to war in that part of the world. It was there before the trenches. It will be there after the memory of the trenches has faded from living experience entirely. 3,000 years ago, someone whose name we will never know observed that packing this plant into a wound made the wound behave differently, bleed less, fester less, close more cleanly. They told someone. That person told someone. Across the ocean, someone who would never hear that first person's name made the same observation independently, and another, and another. And in 2024, in a laboratory that would be unrecognizable to any of those observers, a chemist can tell you exactly which molecule in that plant is responsible for each of those effects: the coagulation compounds, the antimicrobial terpenes, the anti-inflammatory flavonoids. The observers were right. They were right about a plant that they had no instruments to analyze, in a world that had no concept of the pathogens they were defending against, using a theoretical framework that was entirely wrong about why the plant worked. They were right anyway. That is the most important thing this plant's history teaches us. Not that traditional medicine is equivalent to modern medicine, not that ancient knowledge is infallible, but that careful human observation, sustained across enough time and enough cultures and enough wounds, can identify real biological activity, even in the complete absence of the theoretical framework needed to explain it. The explanation came later. The observation was always there, waiting like the plant to be understood.